I rise in support of my amendment to the Choice Arrangement Act. This bill, as written, makes health care less accessible and affordable for our most at-risk workers. My amendment prevents older workers from obscene health care premiums and discrimination. As of January 2023, a record 16.3 million people, including older Americans, were insured under the Affordable Care Act. According to the Center on Budget and Policy Priorities, under the ACA, older adults' uninsured rate has dropped by 1/3, a key indicator their health and wellness have improved. Further, they are now protected from coverage exclusions and cost increases due to pre-existing condition. In 2019, people ages 55 to 64 had the lowest uninsured rate among non-elderly adults. But instead of working to build upon this success, my colleagues are bolstering individual coverage health reimbursement arrangements and association health plans, which have a long, well-documented history of cutting costs for themselves by cherry-picking the cheapest people to cover, leaving the more expensive and vulnerable ones behind. This raises costs for those not chosen and causes premiums to go up for the rest of the insurance market. Republicans have been pushing these efforts for decades, and experts have consistently found it to be harmful. In its final rule adopted in 2018 by the Trump administration, the Department of Labor acknowledged as much, noting the AHPs could, quote, use their regulatory flexibility to design more tailored, less comprehensive health coverage, which will necessarily lead to some favorable risk selection towards AHPs and adverse selection against individuals and small group markets, end quote. They predicted this would raise premiums for consumers who were left behind in the small group and individual markets. For decades, independent experts at the American Academy of Actuaries and the Congressional Budget Office have repeatedly found premiums for older workers would be higher as a result of association health plan legislation. The bill has only superficial protections from discrimination based on health status and is entirely silent on discrimination in pricing against older individuals. And in fact, by explicitly allowing associations to base premiums on the risk factor of each employee within the group, it invites them to discriminate against other characteristics. My amendment requires the Department of Labor to certify that the bill would not raise premium for older Americans before taking effect. I ask my colleagues to support my amendment to protect older Americans and implore that we work together to address the real health care problems in our nation and move towards a more equitable health care system for older workers. I reserve the balance of my time.
From Connecticut reserves, and for what purpose does the gentlelady from North Carolina seek recognition?
Thank you, Madam Chair. I rise in opposition to the amendment.
The gentlewoman is recognized for 5 minutes.
Thank you, Madam Chair. I yield myself such time as I may consume. I'm pleased our Democrat colleagues are finally expressing some concern for rising health care costs, particularly the burden those costs can impose on our nation's seniors. I'd like to remind my Democrat colleagues that Medicare is expected to become insolvent in 8 years. Increasing access to AHPs may be a life-saving option for these seniors if Congress does not address Medicare's insolvency issues. Unfortunately for seniors, premiums of older Americans have risen drastically thanks to Obamacare. In fact, health plans in New York just requested rate bumps of up to 40%. The percentage of health care costs paid by a health insurance plan is known as the actuarial value, AV. On average, the AV of an individual employer-sponsored plan is 83%. When compared to the 70% AV of a silver plan and even the 80% AV of a gold plan on the Affordable Care Act exchanges, employer-sponsored plans provide affordable and more comprehensive coverage than ACA plans. Employer-sponsored plans also have lower average deductibles, $1,763 for an individual employer-sponsored insurance plan compared with $5,155 for an individual ACA exchange silver plan. I'd like to repeat that. $1,763 on an employer-sponsored plan for an individual employer-sponsored insurance plan, compared with $5,155 for an individual ACA exchange silver plan. And individual employer-sponsored plans have lower average out-of-pocket costs than ACA exchange plans. $4,355 is the average maximum for an individual sponsored insurance plan, compared with an average maximum of $8,519 for an individual marketplace silver/ACA plan. Clearly, our government-run and government-subsidized health care programs are facing incredible fiscal challenges. I'd urge my colleagues to be more concerned with the older adults enrolled in those programs than those enrolled in large group employer plans. This amendment's an insincere attempt to delay implementation of common sense policies that will increase health coverage options for all Americans. Instead, AHPs and the coverage options provided under this bill give older Americans more affordable coverage options. For these reasons, I urge my colleagues to vote no on the amendment, yes on the underlying bill, and I reserve the balance of my time.
The gentlelady from North Carolina reserves, and the gentlelady from Connecticut is recognized.
I yield 2 minutes to the distinguished ranking member of the Committee on Education and Workforce, Mr. Scott.
The gentleman from Virginia is recognized for 2 minutes.
Thank you, Madam Chair, and thank the gentlelady for yielding. I rise in support of this amendment. The Association of Health Plans have a long, well-documented history of cutting costs for themselves while cherry-picking the cheapest people to cover and leaving the more expensive behind. This raises the cost for everybody else and causes premiums to go up for the rest of the market. Republicans have been pushing this idea for decades, and experts have consistently found it to be harmful. The Affordable Care Act made a number of reforms to commercial insurance markets, including the requirement that plans in the individual and small group markets cover essential health benefits such as maternity care and prescriptive drugs. The ACA also prevented these plans from charging higher rates based on health status and limited premium amount that older people would pay compared to younger people. This is a vital protection that ensured that an age tax would not make coverage unaffordable for older individuals. But this legislation has no protection without this amendment. The bill is entirely silent on discriminatory pricing against older people. And in fact, by explicitly allowing associations to base premiums on risk factors, each employee within the group, it actually invites them to charge older Americans much more. This amendment would ensure that older workers are protected by providing in this bill that it would not take effect unless the Secretary of Labor certifies that it would not have the impact of raising premiums for older workers. And I thank the gentlewoman from Connecticut for her leadership on the Education and Workforce Committee, and I urge my colleagues to support the amendment.
The gentleman from Virginia yields back. The gentlelady from Connecticut reserves.
Reserves.
The gentlewoman from North Carolina is recognized.
Madam Chair, I believe I have the right to close, so I will reserve.
The gentlelady from North Carolina reserves. The gentlelady from Connecticut is recognized.
I'm prepared to close. I just urge my colleagues to support this common sense amendment to protect older Americans and pre-existing conditions. The ACA expanded Medicare for low-income Americans and protected coverage to people with pre-existing conditions. We want to make sure we continue that tradition and make sure that the Choice Arrangement Act will not go into effect until the Secretary of Labor certifies that this bill will not result in higher premiums for older Americans and seniors. It's critical that we protect this access. Thank you, Madam Speaker, and I yield back.
Gentlelady from Connecticut yields back. The gentlelady from North Carolina is recognized.
Thank you, Madam Chair. Madam Chair, again, our colleagues continue to try to mislead the American people about what this bill does. These plans cannot cherry pick, cannot exclude, must cover pre-existing conditions. The opposition to this bill from our colleagues across the aisle unfortunately, is to freedom of choice. The title of this bill is the Choice Act. Freedom of choice, which would allow people to stay out of the Non-Affordable Care Act, known as Obamacare, but still have affordable health insurance. This bill is about choice and freedom and good health care coverage. And we should approve the bill without this amendment. I yield back. I ask my colleagues to vote no on the amendment, and I yield back the balance of my time.